Okay, sorry, I went for a run between these videos, so I apologize for general sweatiness and dishevelment, but exercise, good. Okay, so clearly I've already given this away, I think. This is a CT, predictable density relations, poor resolution of sulci and gyri. It is in the transverse or axial plane, and this image on the right is superior in level to this image on the left. And I know that for a few reasons. First, I'm seeing more of the third and fourth ventricle in this image. And second, I'm seeing the shape of the occipital or posterior horns of the lateral ventricles in this image. And these are actually, you can tell, these are the tips of the inferior horns. So all of those things together shows that this is inferior to this. The image on the right is superior, in case there's any mismatch between pointer and speech. Now, both of them are slightly oblique sections, and also you can see that the ventricles are hugely distorted in this child. So because the fourth ventricle is obstructed, everything rostral to the obstruction is distended. So both lateral ventricles, the third ventricle, and what remains of the fourth ventricle that's not filled with tumor. This is how you would treat that tumor. So it's ventricular shunting, and you need to place the catheter that you're going to shunt out with proximal to the occlusion. So in this, and you would like to place it in a spacious compartment, right? So it's going to be pretty dangerous, even though theoretically you could reduce this fluid, this hydrocephalus, by putting a catheter in the third ventricle. That is not a particularly accessible location. It's super deep and medial in the brain. So typically they're put in a lateral ventricle, the tip of the catheter. This is an open drainage tube. It tunnels under the skin and empties into the chest, or typically into the abdomen, to get rid of fluid. And that will relieve the hydrocephalus, relieve intraventricular, and by proxy intracranial pressure in this child. And it is a lot safer, you can imagine, than attempting to surgically resect a tumor in the fourth ventricle. Now, they probably have to do some sort of treatment, but this would be the acute fix. So the barriers in the brain. So there's a lot of confusion around where these two barriers actually are. So there's the BBB, which most of us have heard of, the blood-brain barrier, and the blood-CSF barrier, or the BCB. So these are two different barriers that separate two different compartments, obviously, and they're created by two different types of cells. So the blood-brain barrier that actually describes the tight junctions of the endothelial cells of the capillary walls of intraparenchymal capillaries. And the parenchyma of an organ is just the business functional tissue of the organ, as opposed to connective tissue around the outside of it. So this is parenchyma of the brain, and inside the brain, in the parenchyma, the penetrating capillaries of the brain are non-permeable, and they're reinforced by glial cells, but really it's the tight junctions between capillary cells that, between the endothelial cells of these capillaries, that conclusively create the BBB. The BCB is here in the ventricles for one location, and it's created by the tight junctions of these epithelial cells, specialized epithelial cells or ependymal cells of the choroid plexus. So we'll talk about the BCB, the blood-CSF barrier, first. And if you look this is a coronal section of the lateral ventricles, we look at an outcropping of choroid plexus within a lateral ventricle, and then we look up close at the wall, we see the arrangement. So these capillaries are very permeable, as we've already said. The blood and fluid and not blood, fluid and other ions from these capillaries leak freely into the space between, they're closely approximated, but there is a space between the choroid capillaries and the choroid epithelial cells. But these tight junctions between epithelial cells make sure that the blood and the other contents are conclusively separated from the CSF. So there's no sort of random mixing. These secretory cells use fluid from the blood to produce CSF and selectively allow CSF that's newly produced to secrete, but not all the contents of the blood to pass into the CSF. Now there's a question on this slide, where is the other critical portion of the BCB? And a little bit of I'll just answer it. So it is at the arachnoid villus. The arachnoid villus is only a one-way valve. It does not allow backflow from the venous blood into the subarachnoid space. And there's actually kind of one other location we're coming to. Maybe you can think of it already. Now, the BBB is in the brain parenchyma, and it is, as I've said, these tight junctions between capillary endothelial cells reinforced by specialized glia, including pericytes and astrocytes, whereas the BCB is mainly a property of the tight junctions of the ependymal cell layer. So it's the ependymal cells of the choroid plexus that form this junction, and the vascular endothelial cells that form this barrier. Say that again. It's the tight junctions between ependymal cells of the choroid plexus that create this barrier, and the tight junction between vascular endothelial cells that form this barrier. And this is kind of an arrangement. I like this schematic because it shows you kind of where everything is maybe. So if you think about this, here you're deep in the brain, a capillary is passing through, and you've got a whole bunch of glia around it, you've got some interstitial fluid, but the brain neurons are right here, and then this is a ventricle filled with CSF, and a capillary here is in the choroid plexus. So make sure you understand the anatomical separation of these compartments. And as I said here, the BCB separates the CSF from the bloodstream, and this happens in the ventricles as well as in the subarachnoid space. So that's the other key location at arachnoid villi and other places in the subarachnoid space. I'll skip ahead in a minute just because I want to illustrate that while I'm talking about it. So recall that we have the dura and the arachnoid and then the subarachnoid space. So there is a tight layer of barrier cells, which is what's showing you here. These yellow cells have tight junctions, and they prevent CSF from leaking out of the subarachnoid space. And so that is what the arrows are pointing at. Okay, so the BCB and BBB both serve boundary functions, but with very different anatomy. So one, tight junctions of capillary endothelial cells in the brain parenchyma. The other, tight junction between epithelial cells that line the ventricular system, as well as reinforce the arachnoid. And yes, we talked about this, the arachnoid barrier. Good. I think we've kind of done this to death. And so this, I'll talk through this actually because we're almost done. So the neurovascular unit, or the blood-brain barrier, this is in the brain parenchyma here, right? So in the meat of the brain, if you will, not outside it or within it. And you can see red blood cells are as well as fluid are prevented from exiting by these tight junctions between vascular endothelial cells, reinforced by glia like pericytes and the end feet of astrocytes. And that's in contrast to the BCB of the choroid plexus, where the capillaries themselves, there are no tight junctions between choroidal capillaries endothelial cells, or between choroidal capillary endothelial cells. Those are porous. They allow fluid to escape for CSF production, but the barrier is selectively in these specialized epithelial cells. And finally, the arachnoid barrier. And so this is the subarachnoid space, and CSF cannot flow out of it except at arachnoid villi, because of these boundary cells shown in yellow with tight junctions. Good. So this is a schematic of everything we just talked about in all these layers. So make sure you can sort of work around this and through it from superficial to deep in the brain. So we can start anywhere. We can start deep and go superficial. Actually, let's start superficially and go deep. So here we have a capillary that's extracerebral, so on the surface of the brain. It's actually outside the brain. And substances can exit extracerebral capillaries because they're not super tight, but then they're blocked by the arachnoid barrier, so they can't access the subarachnoid space. So that is the first barrier. Substances can not exit an intracerebral capillary because these capillaries are not fenestrated, right? Substances can exit the achoroidal capillary, but then they run into the choroid epithelial barrier that surrounds the ventricles. So they can't escape into the CSF. And so we have these barrier systems in the brain, either between arachnoid cells, choroid epithelium cells, or vascular endothelial cells within the brain parenchyma. All of these barriers protect the brain, and they prevent substances from getting in and out and accessing the brain via the CSF or out of the blood. But that's probably most of you know, that's a two-way street. So there's pluses and minuses to these barrier systems. On the plus side, it protects the brain from metabolic effects of all kinds of toxic substances. On the negative side, the barrier systems, all of these barrier systems together, render the brain, almost all parts of the brain, sort of inaccessible to therapeutic agents. So some therapeutic agents we're trying to deliver to perhaps treat a brain tumor can't access the brain parenchyma, and it's a real problem.